Okay, we're making a case assessment for Ophelia. Ophelia has done moderately well. I was in between. We've had good moments, we've had bad moments. I can't say we've ever had some really good long periods of 18, 20 hour wear. You're always on the sort of 16, 17, sometimes dropping down to 12-hour wear. Now, the problem with that often is you end up with a little bit of a deep bite situation, as Ophelia's got. So bite together. So the upper front teeth are sticking forward slightly, and we've got a little bit of a deep bite situation. We've been in the stage 4 appliance. You'll see we've got the bumps on Ophelia's front teeth. Now, having been in the stage 4 appliance, what I did at the latter phase of the stage 4 appliance was remove the clasps on the 6s, which allowed the 6s to move forward to help close our spaces and allow the 7 to erupt. But Ophelia's only 11 now, the 7's not quite erupted. The timer has now failed on the stage 4. We want Ophelia wearing it 12 hours a day. She forgot her appliance, and it's quite apparent she's only wearing it at night, which is less than we wanted. We only recently went down to 12 hours, and of course Ophelia, I said 12, Ophelia heard night times only, which is not uncommon, but without the timer and the brace, I don't have that fine control.
Could I make a point here, because Ophelia's also told me that it's coming out at night sometimes, and when everyone says that, I always, it worries me.
Yes, so we're probably got a lot less wear. So where we wanted 12, we could easily be down on averaging 4 or 5 hours a night. Of course, this deep bite's going to get worse. We've got that cleft down here, yeah, with the mentolabial fold. So she's swallowing with that lip coming back. You know, all of that's going to hold those lower incisors back. All very indicative of that deep bite not going to go away. So what are we going to do next with Ophelia? Because we need to make a new appliance. I'd love to go to a stage 3 appliance, so I'm not holding on to my incisors and we can do something about moving my incisors. Now, the problem with the deep bite is getting out of the deep bite. So we leave Ophelia with a nice, much more class 1 situation. Remember, I'm happy to leave a slight anti-open bite. I'm very happy with that. I don't want to leave a deep bite because they tend to get worse. Now, we were discussing what to do.
Yes. Ideally, when I've had a failed case, I usually, I won't call it a failed case, all right, when I have problems with deep bites in the long term, I often think the best thing is to go back to a stage 1, expand, correct the indicator lines from scratch. But she hasn't gone that much, the bite's not over deep. I think there's a reasonable chance of correcting it purely by moving the incisors alone. It will open up the space, but in my experience the space will close later, and certainly the space could easily be made behind the canine, possibly even behind the first premolar.
So what you've got with Ophelia now is that you've got these incisors are sticking down a little bit like that, but because the incisors have dropped down and come forward in relative terms, there's now a space between the incisors and the canine, and the canines are actually in a nice class 1 position. So really what we want the incisors to do is to come back like that, but you won't get that movement. So the idea is to move the incisors up and forwards like that, hold the cap wire behind the incisors, and then they'll upright, which means we need to move the lower incisors forwards. The lower teeth will shuffle around and fill that space up without any problems. But then I've got to get the 3 and the 4 forwards. Well, and the 5 and then the 6. Same thing with mesializing teeth that we've already had. Now, the question is, we don't have 7s in place. So without 7s in place, do I crib the 6s, put a pad on the 7s? Well, I worry that it would make the place that rocks. The appliance will rock down and fall down, and then your anterior locks aren't going to be as effective, and I will never get done what I want to get done. Because if I want to push those lower incisors forwards on the nudge, you have to have fantastic locks. Really, really good locks, and do it very slowly. So I think what we'll do is make a stage 3 based on one of the premolars. Now, in discussion with Dad, I think we'll go for the 4, because then you get you're much closer to the anterior segment. If you're much closer to the anterior segment, you can affect the anterior segment more. So then we can push those upper incisors up a little bit. We can push those lower incisors forwards. We'll get the 3 forwards with an approximating wire. Then by now the 7 should have erupted. So then I can go back to the 6, make a new appliance on the 6, rest on the 7, get the 4 and the 5 forwards, and by then I should be up into a nice incisor class 1.